Welcome to Armstrong and Small Eye Care Center. My name is Dr. Luke Small, and today we're going to talk a little bit about infant eye exams. So I get a ton of parents that ask me, how can you possibly do an eye exam on my 6-month-old? And today we have our lovely, squirmy, hi Kenzy. Hi. Are we doing a film debut? And so Kenzy is my lovely 8-month? 8-month-old niece, and I've got my sister Sammy Jo Small, and on the other side of the camera we have our lovely brother-in-law Billy Bridges, who's filming. So today we're going to kind of go through what I normally would do with someone her age, in terms of trying to determine exactly 3 things. We want to try, if we can, to determine, are the 2 eyes working together? Does she have a high prescription in either eye? Yes, that's right. And are the eyes healthy? The biggest thing when people think of an eye exam is they think of, how can you ever figure out how my child sees? And that's really hard to do. There are specific tests, certain things called preferential looking, different things like that we can try and get an acuity, but we're really not too worried about that. There's a lot of things we can do without her saying anything at all, and you can tell that she's fairly non-verbal, although she's going to make some noises for us today. So as I go through this quick eye exam, I'm trying to make sure that this is fairly quick because we've got to keep her attention. She's just come up from a nap, which is always important because ideally we want the child to be well rested. Also, a lot of times when we're doing an eye exam on a kid this age, we'd be talking about drops, and those are cycloplegic drops, and those are drops that are put in the eyes, make the pupils really big, helps us look in, but it also helps them that they can't focus anymore. I'm not going to be doing that today at this point, but normally we would be putting the drops in before the eye exam too. So Kenzy, we're going to go through some stuff, kiddo. Now, if you have a child who's say 3 or 4 and we've got an eye chart with some pictures, then I would show the child, obviously we've got an apple, square, circle, house, and then instead of going through, for instance, letters or numbers that the kid may not know, they can generally tell us, and that usually starts at about age 3. Even younger than that, sometimes at say age 2, we can do a broken wheel test, and I can hold these on either side, stand at a certain distance, and the child can tell me which has the broken wheel. Well, Kenzy's not going to be able to tell that to me today, so I'm not too worried about it, what we call an acuity, or how well she sees. So we're going to try a couple things right off the hop here. And one of the things I want to do is called a cover test. And on a cover test, yes, hi. So I want to try and get her attention. And one of the things that works best at getting her attention is our new little, oh yeah, you can see that gets your attention. And then generally I'm going to be watching her eyes. So go back and forth. Good job, Ken. Oh, we lost her. Don't drop Sophie. There you go. Oh, good. So as I cover and uncover, I'm watching her eyes to see what they do. Oh, do you want to hold that? Do you want to hold it? Maybe? Yeah, very good, Kenzy. So now I've also got, we want to try and check that same thing on how her 2 eyes work together, but looking a little further away. Now, for a 2, 3, 4, 5-year-old, cartoons work really well at doing that, and we've actually got some different Pixar cartoons. The tough part with that is at her age, she's not as interested in the cartoon as she is now at sucking on the light that we've got. So Kenzy, can you look at, do you see the cartoon? Kenzy, do you see that? Oh, what's that? Good girl. You watch the TV. Good girl.
Or watch Daddy.
Either way. Oh, and that's the other thing, is trying to keep their attention. Yeah. What if we go way out here? Do you see the ball? Do you see the ball? Yeah. Good job, kiddo. Yeah. Okay, now we're going to move in to see how her muscles work together. And she's going to move her head, but I'm just making sure that she gets a full range of motion here. Yeah, good job, Kenzy. Good job. And what about out here? Where'd it go? Ah, there it is. Good girl. And we're going to follow it down here. Yeah, and there. And we're going to follow it super close. Whoa, yeah, you can bring your eyes together. Good job. Do you want that back?
You want to hold that?
Yeah. Now, we can also double check to see how her peripheral vision is. And there's a couple ways, but if I hold this right here, and then oh, yeah, you saw that already. And, oh, yeah, you saw that. Kenzy, look back here. Oh, you're tough to trick. You're tough to trick. So I'm looking to see when she first sees that. Oh, I know.
Uh-huh.
Did you see it already? What about over here? Yeah, that's a good girl. Kenzy, you're awesome. And we especially like your t-shirt. Thank you for wearing that for me. You're doing so well. So now let's check some pupils. We want to make sure your pupils are working. So we're going to get a little darker in here. Be a little harder to see, but we're going to watch. Yeah. Ah, what's that? And I'm making sure those pupils do. And she's watching the cartoon. Good job. I know. Yeah. Good job, kiddo. Good job. Thank you. Thank you. You did awesome. Now, the next part we're trying to determine is to see exactly roughly where her prescription would be. And this is where, when we're doing, if she's got drops in her eyes, her pupils aren't going to go back and forth. They're going to be held wide open for me. So we do something called retinoscopy. I'm just going to pause the cartoon here. And retinoscopy's been around for 100 years. My dad did retinoscopy. My grandpa did retinoscopy. And what that is, it's a streak of light that we're going to be shining at her eye. The way the light moves actually tells us what her prescription would be. Now, this is a quick, sometimes difficult exam depending on how squirmy the kids are. But it can give us a really good approximation of exactly where her prescription is. And what I want to see is the prescription really high, whether she's really farsighted or potentially nearsighted, or does she have one eye that's way different than the other. So you'll see this light kind of going back and forth. Now I'm going to get it dark in here again, which makes it a little bit more difficult for the camera. And whether she will look far away is always the difficult part too. So we're going to try here. Now, I should mention too, sorry, light's coming back on, is that we have to hold a lens in front of her. So there's something called lens bars that we'll sometimes use, and you'll see an optometrist grab a set of these, because trying to use this big guy in front of her age is pretty scary, and we tend to avoid that at this age. So with this, on some kids, I'm able to get this pretty close, and I can go up and down. Kenzy, you see, she wants to grab that. So I'm just going to give that to her, so she's got something else to play with. So I often use just a single lens, and that helps me to determine roughly where her prescription is. And if we do that, and if we put the cartoons back on, and she might watch the cartoons. Do you want to give that back to me, kiddo? Are you giving it back?
Yeah.
Oh, thank you. Yeah. And what's the cartoon down there? Huh?
Look at Daddy. Look at Daddy.
Yeah, good job, kiddo. Oh, good job. Yeah, you want to look right at me, which, not too bad. Yeah, and you want to move that out of the way. Yeah. So normally if we would be trying to get her to look a little further away in this, line that up. Yes, good job, kiddo. So that's one eye. And then we're going to have our cameraman wheel back a little bit, and I'm going to slide over here.
Here, you can hold Sophie back there.
We're going to put our cameraman to work so that he does a couple things. Yeah, hi. We're going to pretend like you're looking far away. Good job. Way to go, Kenzy. Yeah. So the other part that I'm doing with this too is that I'm getting a pretty good reflex. And the reflex means like when you're taking a picture from a camera. Yeah. And you get that red reflex. We just want to make sure that it's nice and clear. I'm just going to, Billy moves back a little bit. Yeah, there we go. One of the things that we'll watch for at this age is something called a retinoblastoma. Very, very rare, but it can occur. And that's where you'll hear about kids where they've had a picture taken and one eye has the very red reflex and on the other side it almost appears white. And that can actually be a tumor of the retina, which is never a good thing. So we're always double checking that, even though it's very rare. And she's doing nice. Yeah. So we've made sure that both eyes are working together. We've made sure that the muscles are functioning to their full amount that they should be. She can bring her eyes well in together. We know that her prescription is roughly the same between the two eyes, and it's not really high and it's not really low. The last thing we want to do is to make sure that the eyes are healthy. So we're going to just double check here, and we're going to do a couple things. So I like to use a larger lens just to get right around. Whoa, can't see, that's right. You can see. Yeah, good job, kiddo. Good job. And yeah, and she wants to push me away a little bit. So I'm just taking a quick look at the lids and the lashes and all those kind of things. And yeah, hi. We're going to raise you up. We're going to go up. We're almost done. We're almost done. You're doing so well. Okay. So now I get in nice and close, and we're just going to have a peek right inside. And she holds really well for me. You coming in for kisses? I know normally we wouldn't do that, but you're my niece, so that's okay. Let's try the other side. Oh, I'm running out of room here. Sam, I'm going to lean against you. Good job, kids. Oh, awesome. Good job, Kenz. And you can see that happens really quickly. So that pretty much ends the eye exam. As I say, normally the thing that I would be doing is adding in some drops. Today we didn't do that, but I was able to get a really good sense of how her eyes are functioning for her age. And there's certain milestones that we'd be looking at. At 6 months, she's already starting to have her 3D depth perception vision. That's all kicking in, those kind of things. And really, mom and dad don't have any concerns at this point. Sometimes at this young age, you will start to even see an eye turn, those kind of things, and all of that's been really good for her.
Yeah.
So she did awesome. So
You want some
stay
milk?
tuned for other videos in the same category that we're trying to explain to parents exactly what we're trying to do during this eye exam. But now you can see in terms of infants, there's a lot that we can do without having to worry about whether they can see our chart that she's got, just like on her.
You say goodbye?
Yeah, do you have bye-byes? Maybe? Maybe? Thinking about it.
Yeah.
Watching Daddy. So thank you to Sammy Joe and thank you to Billy for filming today. And Kenzie, thank you. Thank you so much. Thank you so much, Happy. Yeah.
Smiley? Yeah, you smile.
You did so well.
Oh,
You
should I have
did so
turned it on?
well.